Hi, I'm Liana Sikavi, and I'm an early childhood educator in the Los Angeles area who works with children ages 2 through 5. We have moved to a virtual learning model since March 16th when a directive came to close the schools to the public. At first, the challenge of implementing virtual classrooms was chaotic, especially when having to learn to use Zoom meetings more effectively. The biggest challenge is that of guiding the individual emotional developmental needs of the children, which cannot be done only by a virtual meeting tool. We care deeply about each of our students. As teachers, we're constantly thinking about our students and their well-being. So naturally, we worked hard to make virtual learning as effective as possible. I think the biggest takeaway with virtual learning is that we are also learning how to use it and to become less critical of ourselves, not knowing the continued responses and reactions of the children after each virtual training session. We as teachers may not be able to teach our lessons to every student, but I think it is vital to continue dialogue with the students in a group setting and individually by continued solicitation of their views. My virtual learning is not just reading a story or teaching a lesson, but it is more about interacting with my students and allowing them to share what they have to say in the moment. It is a chance for me to meet their social emotional needs during this heightened state. It is a work in progress, but we provide activities, resources, materials, virtual playdates, circle time, and story time in our Zoom meetings, as well as separate interactions we have with each child and their caregiver. One challenge my colleagues refer to is the inability to react to conditions and adjust your program in real time based on the children's reaction. Virtual sessions often means second guessing what you need to say next. Virtual classrooms are a chance for me to commend and praise the caregivers that are dealing with all the chaos while continuing to raise their children the best way they can. Through virtual learning, I am able to connect with these caregivers and ask them how they are feeling as well. We spend a lot of time learning about children's resilience and coping skills while they are stuck in their homes. All of the children are spending more time with their caregivers, and for young children, this is extremely beneficial to their needs if the environment is safe. If I can make one child smile, laugh, or speak up in virtual learning, then I think I've done my job well. Thank you for listening.